Lung cancer is one of the most common cancers and it's the highest killing disease in the world. Lung cancer kills more people of all cancers throughout the globe. And this is primarily meant for those who are smokers, because smoking is an important etiological factor for lung cancer. All over the globe, those who smoke more has higher incidences of lung cancer, and this has been proved beyond doubt. Lung cancer is a very common problem of our country because smoking starts early in our age, and there is no control over the smoking history of these patients. And tobacco is freely available throughout the country, and even to those who should not be consuming tobacco. Lung cancer also is a very important problem for our country because it also cohabits with another disease, which is pulmonary tuberculosis. Now, pulmonary tuberculosis is a very common disease in Indian subset, and it is endemic in this part of the world. And most of the symptoms of lung cancers overlap with pulmonary tuberculosis, and hence it is often very difficult to or diagnose lung cancer very early, and most of the people end up taking a lot of anti-tubercular drugs, and thereby when they do not respond, they come up with the physicians with advanced lung cancers. Lung cancer again is a disease which should be tackled early, but unfortunately it doesn't have a very unique symptoms to detect. So what we need to do, physicians need to be very careful as far as detection of lung cancer is concerned. Chest X-ray is one of the mainstays of diagnosis, but by the time we detect lung cancer on a chest X-ray, most of them are inoperable. The usual thing is to use a CT scan to diagnose lung cancer. Sputum cytology is an important aspect, but most important is carefulness about the physician and suspicion about the physician that this patient can be harboring lung cancer is the most important clue to diagnosis. Lung cancer is usually diagnosed by bronchoscopy, sputum cytology, biopsies from under CT guidance, and chest X-rays and CT scans. It also needs to do a metastatic workup because lung cancer spreads to other parts of the body very often, and thereby most of the lung cancers are diagnosed in stage 3B and 4, which are advanced lung cancer and hence incurable. Lung cancer is only curable in early part of the disease, which is stage 1, stage 2, where it can be cured by surgery. Usual treatment choices is again surgery, chemotherapy and radiotherapy. Early stage lung cancer is often taken care of by surgery alone and sometimes followed by chemotherapy. Locally advanced or stage 3A lung cancers or 3B lung cancer are often treated by chemotherapy and radiotherapy in combination, and thereafter some of them may undergo surgery. Stage 4 lung cancers are often treated by chemotherapy alone. Nowadays, of course, targeted therapies are also available for lung cancers, and for that, biopsy of lung cancer is very important. FNAC does not suffice. We need to know whether the subtype of lung cancer is, whether it's a squamous cell carcinoma or adenocarcinoma or other cancer varieties. We also need to know whether they are mutation throwing up cancers like EGFR mutation or ALK mutation, and thereby we can treat these drugs with targeted therapy. Oral drugs are available for EGFR mutated cancer patients. Oral drugs are available for ALK mutated cancer patients, and they usually have an indolent process of disease development than non-mutated patients. Lung cancer, of course, has come a long way. Earlier, this used to be called a disease where even chemotherapy doesn't help, and best supportive care was the order of the day. Now we have come to the age of chemotherapy. We have also come to the age of first line, second line, third line chemotherapy, and a disease where advanced cancer used to live for 3 months now are living for more than 3 years. So it's a very rapid stride which we have made in lung cancer development, and I wish smoking cessation will bring this disease under control. There should be strong smoking cessation and awareness for these programs so that lung cancer, which is a lifestyle dependent disease, can be nipped in the bud.